Welcome to today's Prevention Matters panel session. It's the 16th in our series, and the title of it is Building Data Infrastructure Needed to Prevent Youth Homelessness in Canada, with learnings from BC and Calgary. So I think we all know this, but prevention is necessary if we want to solve the current growing homelessness crisis. This series exists to clarify what prevention means in addressing homelessness. What can we do to reduce the chances that someone will experience homelessness in the first place? What can be done to support people who are at high risk of homelessness or who have recently become homeless? And how can we ensure that people who have experienced homelessness and who are now housed do not face housing precarity again? To delve into these questions, Prevention Matters invites brilliant minds to tell us what homelessness prevention looks like in their communities, along with the lessons they've learned along the way. So in today's panel discussion, we'll explore how stronger data infrastructure can support more effective youth homelessness prevention in Canada. We'll be joined by the team from PolicyWise for Children and Families. They will explain what prevention-focused data looks like in practice, the challenges of sharing this data across different systems, and the consequences of the disconnect when governments, community organizations, and researchers are unable to easily connect their data. Our panelists will share insights from their collaborative data projects, including cross-ministry data in BC and community-level collaboration in Calgary, highlighting key learnings and real-world challenges. We'll also look ahead to what this work means for communities across Canada. Our hope is that you'll leave the session with a clearer sense of how collaborative data can strengthen policy, research, and coordinated prevention efforts, where promising foundations already exist, where gaps remain, and what practical first steps policymakers, funders, researchers, and leaders can take to begin building the data infrastructure needed to better prevent youth homelessness. Before we get into it, I wanted to remind you that our panels are not your typical webinar. Your participation is a key part of this experience, and we strongly encourage you to engage amongst yourselves in the chat and ask any and all questions you may have. Following the discussion, there'll be an open Q&A, so if you were to take a look for the Q&A button in the bottom of your screen, you'll be able to leave us questions there that we'll be able to ask the panelist in the second half of the session. Importantly, this work reinforces the role that strong connected data can play in making prevention possible. Today's panel is a chance to learn from these real-world experiences and consider how collaborative data approaches might apply in your community or an area of work. Please share your reflections in the chat if something a panelist says resonates with you, and always, we invite you to keep the conversation kind, thoughtful, and engaged. And I wanted to highlight that your feedback is very important to us, so if you have any thoughts that could help us improve your experience for future sessions, we'd really appreciate you sharing them. Lindsay, my colleague, will be sharing a link in the chat where you can, a form that you can go and leave your feedback. And lastly, I'd like to start this panel with providing a land acknowledgement. It's important for us to pay respect to the traditional guardians of the land, which many of us are calling in from today. The Canadian Observatory on Homelessness recognizes the long-standing and ongoing relationship that Indigenous peoples have with Turtle Island, which includes both ceded and traditional lands, and also includes the land known as Canada. In addition to our land acknowledgement, I wanted to take a moment to encourage you to learn something about the history of the land where you reside today. Lindsay will be sharing a resource in the chat where you can look up a particular city, county, or even an entire province and learn about the territories, languages, and treaties of that land. And if you're watching this recording back on YouTube, this resource will be linked in the description or somewhere on the webpage. So I still invite you to check it out and learn something new. So because the COH is based at York University in Toronto, I'll go ahead and share their land acknowledgement. So we acknowledge that our presence on the traditional territory of many Indigenous nations. The area known as Tkaronto has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. The territory is subject of the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. So without further ado, I'll hand it over to our host today for introductions.
Okay, thank you everybody for showing up. Really looking forward to today's panel. I'm Stephen Gates. I'm a professor at York University in Toronto, and I lead the Canadian Observatory on Homelessness and also co-led the Making the Shift Social Innovation Lab, co-led with Melanie Redmond and Away Home Canada. So let's do a round of introductions. If you can just tell us a bit about yourself, and we'll go from there.
Hi, everyone. So excited to be here today. Thanks to the Prevention Matters team for inviting us and organizing this session. My name's Kaylee Pritchard. I use she, her pronouns, and I'm joining from Calgary, Alberta, though it's been known as Mohkinstsis for much longer by the Blackfoot Confederacy. And Kieran, Matt, and I all work for PolicyWise for Children and Families. So that's a nonprofit and charitable organization. And our mission is to inform, identify, and promote effective social policy and practice to improve the well-being of children, youth, families, and communities. So essentially, we do a lot of research and evaluation work with other nonprofits, with governments, and our offices are located in Alberta, but we do work nationally. And I'll pass it over to Matt.
Thank you. And yeah, I'm excited to be on the call. I'm Matt Russell with PolicyWise for Children and Families as well. I'm a senior research and policy associate. Um, in terms of some of the work I do, I often have been a person who's been working with administrative data. So actually, I was working with a famous data set here in Alberta, where I'm currently seated in Edmonton in Treaty 6 territory. Um, Here, from that work, it's sort of expanded to some other work that we're doing, and I've done with Making the Shift, where we work together to build a roadmap, engaging hundreds of people across Canada to get their input on how we could improve data to inform the prevention of youth homelessness. So some of those sort of topics are we're going to talk about today, but today the work that I'm really going to be focusing on more will be on some of the work I'm doing with the BC, in partnership with the BC government, to look at some of those predictors for youth homelessness. I was just looking through the participant list and I'm excited. I see lots of people I know on the call, some from that roadmap engagement, some from the BC work, and I'm excited to talk more about it. Thank you. Kieran.
Thanks, Matt. Good morning or good afternoon, depending on where you're joining from today. My name is Kieran. I'm also a senior research and policy associate at PolicyWise. I'm located in Mohkinstsis in Treaty 7 territory, so I work alongside Kaylee at our Calgary office. My background into this work is a bit more convoluted. I actually have a background in environmental science, but then also segued into public policy to try to kind of bring the technical and practical worlds together. And through various channels, kind of also ended up doing some work frontline with a social serving organization in Calgary. And from that kind of discovered it was really great to be connected to the community. But I also still kind of, yearn for that policy side. And so PolicyWise is kind of that place where we're really able to be that bridge between policy and research, but also bring it to the practicalities and realities for community. That's a little bit about me, and yeah, I'll be speaking more to the work around the Calgary collaboration project today.
Great. Thank you, all of you. This is going to be an exciting presentation, and it's an important one for us. When we started Making the Shift Youth Homelessness Social Innovation Lab, one of our key research priority areas was to support projects focusing on data and technology, because there's a growing recognition that data and technology can and should play more of a role in the work that we do. Whether it's what administrative data do we collect and what are we not collecting that we should, um, different linking administrative data, um, cost modeling, using technology to support prevention. Um, and so this is conversation is going to get us somewhere on that. And so I'm going to ask a number of questions, and then as Steph said at the end, We'll open it up for people, so I hope you get a chance to ask a question if that's what you want to do. So let's first start with framing the data challenge here. When we talk about data for youth homelessness prevention, what are we actually referring to, and what does it look like in practice? And uh, why is data that supports prevention so difficult to share? I'll actually ask this question after. So all of you can weigh in on any of these questions.
Perfect. I think I'll start here just because I was in the roadmap project, and I
Right.
feel like I have a few more things there just based on that I'd like to just mention. I'll just say data, all that stuff. Like already, it's a sort of intimidating word when we talk about a data infrastructure, even bigger and all that stuff. Um, and it's a complicated one. I think honestly, we're going to send a link later that has our work. It has the roadmap on it. If you want to learn
Mhm.
those details, I recommend you look at it because there's lots of things there. Um, but the first thing I want to say is when I think about data, it's people. It's about people, it's about relationships, it's about stakeholders. And when we talk about technology, we can have the fanciest system, we can do all those things. But if the relationships and the trust hasn't been built for that, what's coming into it is not going to be very good. And we heard that through our stakeholder engagement. So I think we have to really think about those thoughts, those feelings, those policies, all those things that are involved with the data. So if you were to look at the roadmap, you'd see the first thing it starts with is about that relationships. And then the very last thing is actually talking about the data, which is funny because it's the data roadmap and all that stuff, because data is just the thing. It's a tool. It's a tool that helps you move forward. And that's always been my philosophy, and that's always been the truth. That's always been my training. If you can't engage with the people and you can't work with them where they're at, you can't get there. So you need to inform how you build that data, how you ask those questions by actually engaging with the stakeholders, the community service providers, the youth, policymakers, and see those different viewpoints. There's a lot of things there. Often we just assume our own viewpoint, and probably how we're using the data is inappropriate for that reason because it's not considering how those relationships and the people were involved. Youth will lie in good reasons about how answers or questions are asked of them, especially if they're risky for them or they don't feel like they have that trust, or they need to do that to get the services. And I think those are all justifiable things. Of course, we want perfect data and all those things. If we didn't consider that, uh, what we got is something perhaps different than what it should be. Data, though, if you look at the roadmap, some of the things we talk about, data, actually making the shift was a great example of data that I think is how we often talk about research, learnings, lots of projects, pilots all over there. It's very important that we have those. Those are the foundation for those changes we can make. We shouldn't just change the whole data system. We need to think about it when we pilot it. Unfortunately, though, often what happens is we have that funding, it stops, and it's the pilot. And I know you've had those conversations, Stephen, and it's a
Yeah.
tough reality. But we do need to, once we have those solutions and everything, then we need to build those more foundational changes. So things to detect risk for early prevention. So school-based screening is one example with upstream. There's also different things that could be at moments where maybe a youth was having a transition in their childhood where we could ask questions that could actually lead to those preventions. It doesn't have to be a fancy system to do that. Counts for homelessness. I know sometimes we're hard on these, but it's important to have counts because we want to see if there's a change. Unfortunately, with youth and trying to find them in their earlier years, often those counts can't actually assess those counts very well just because can you see the hidden homelessness? Are we asking it? Do we have those systems? Is it being reported? I think we just had that conversation, Stephen, where we don't have that youth shelter data. It's not even being asked in HIFIS and it's not being
Yeah.
shared. So how is it being counted? We also had a conversation. Sorry, I'm talking a little bit about this too much, but some groups in the world say we don't ask the question, we don't about it. So there's no youth homelessness. No, that's not
Yeah,
true.
that's
It just wasn't asked. It's not in the data. And then there could be things around shelter prevention, and then things like today that I'll talk about are those system change things where we look at bigger data sets, which I'll explain later. So I'll stop there because I could go on this for a while. But if you want to really talk about those things, look at that roadmap. We have different versions. We have things for the stakeholders, all that stuff. Look at our website. It's a great resource. I'll just throw it in the chat directly, but we'll have another link.
Yeah. Would either of you like to add something there?
Yeah, I think as Matt talked about with data really being about people, and recently I've started calling data the D word because I think it can, when you're working with frontline service providers in particular, it can feel like data is like what the evaluators deal with, and
Mhm.
it's big data sets, and we have to pull in all these different people because, I'm focused on the clients and data isn't relevant. So talking about it as like information sharing and recognizing that sharing data in a community service setting can be as little as a youth's name and why they need housing, which could be around health status, knowing other programs or referrals or waiting lists that they're on. That can really be data sharing as well. It doesn't have to be big repositories or things like that. So just wanting to include that definition there.
Kieran, did you want to say anything?
Yeah, I think I'll just add that it's also been this really interesting journey of seeing how people interpret the word data differently. So, speaking to
Yeah.
Kaylee's point, that's one thing that we have had to kind of come into and sometimes, yeah, define. No, 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 it can just be a name. It can just be, a program or the name of the service that they're looking for. It doesn't necessarily need to be this massive data pull, and it doesn't need to be this scary thing. And so, it's been really interesting when thinking about what it looks like in practice because often it's been a reminder that it doesn't necessarily need to be this overwhelming or complex thing, and it can start small. And so and I think kind of coming back to Matt's point that really reminding folks that the data is it's not data sharing or having data for the sake of data. It's really coming back to using it as a tool, as a mechanism to achieve whatever your intention is, and let that define, what the data that makes sense is for this project.
That's great. Okay. So this is a really good start. It's really interesting. A couple of things to mention. I think often in the homelessness world, frontline staff may be responsible for collecting data, but often the organization doesn't have any capacity to do anything with the data. And so it then feels like a waste of their time. The uh, the lack of data being collected on youth experiencing homelessness is a big problem, and it's bigger than I thought it was because in the past year, Government of Canada released a report on youth homelessness, looking at the shelter data, and out of 450 communities that have some kind of homelessness services, only 17% have a youth shelter. And so to pick up on Matthew, what you were saying, if there's no infrastructure, that means there's no data. And if there's no data, that means there's no problem, right? And so people do routinely think youth homelessness is not a big issue. So let's move along here. Okay. Um, Wait a minute. I've got the wrong piece of paper here. Okay. Uh, before doing the work that you were doing, were there examples or jurisdictions or sectors that you looked at as leaders in the areas that you're interested in? Or was it mostly just you had to start where you were?
You two want to go first? I can go too, but
Sure,
Yeah,
I can share.
why don't each time we switch it around who goes first?
That sounds good. Yeah, for our work, we did environmental scan to kind of start off and gain an understanding of what was happening in Alberta and Canada and in a broader setting. So a few that we looked at that were existing. There's CHAIN, which is Combined Homelessness and Information Network, a multi-agency database that records information about folks sleeping rough in London in the UK. For me personally, I'd been involved in a related project in Calgary that's working on starting up a community information exchange. So it's aiming to have a data infrastructure where different agencies and also multi-sector partners, such as health and justice, can share information about clients. And that's getting started up in Calgary. It's learned a lot from the San Diego CIE, and I believe there's
All
also
right.
one in Collingwood, Ontario. So the CIE piece is happening a lot, basically closed loop data sharing. And then we also learned a lot from a specific person, George Alvarez. He's kind of a leader in privacy around data sharing in Alberta, and he worked with Converge Mental Health Coalition on the information sharing framework, which I can drop links to these in the chat. But I highly recommend it for anyone looking to start out information sharing. It really goes through what legislation applies and those kind of pieces.
And maybe I'll just piggyback off that in terms of thinking about what was kind of such an interesting takeaway from looking at these kind of folks that are leading the way is that there really isn't this one standardized approach. We're looking,
Mm.
what are the best practices? We always jump to these kind of terms like best practices. And we really saw that it was actually a series of kind of key considerations as opposed to step by step, this is how you start up a data collaboration or data sharing project. We really saw that, yeah, it's these elements that look different depending on the types of organizations that are participating, what that partnership even is. You can have some small grassroots organizations, and their approach might look really different from organizations that might be part of something already like a community information exchange. And so it was really very enlightening about what are these kind of key foundations, key conversations, key starting points that need to happen to start building the data collaboration, but not necessarily this, here's the model and run with it, but rather here are the key elements that you need to discuss or that you need to think about to build the model that makes the most sense for the intention and purpose of your collaboration.
It's funny. I was looking at my examples and I'm like, oh, two out of the the four is exactly the same and everything. And I so I'm just gonna talk about them again because I know they're good. And it's just because I've had some interviews with these groups and they've really been a foundation of some of the work I've been doing over many, many years. But Chain, so this is actually a rough sleeping data sharing in London. So it's across London. And the issue was
London, England,
London,
or
England. Yeah.
Ontario.
Oh, sorry. You're a very good point. It's an international one in UK, not in Canada. And I don't think there's boroughs in London, Canada. So that's one different. And
Okay.
the issue was across each of the boroughs, they were like little cities. So the issue was they weren't sharing with each other. You go across the street and suddenly your service is completely changed. And they were like, what's going on? What do we do and all this stuff? And they identified that issue and they said, let's make a shared data space where people can have access to data across it. And it's literally across the whole area. So once you have access, you have it to it all. And that presents a unique challenge because there could be a lot of abuses with that data, like worries about law enforcement and using it for different things. So what happens is there's a really strong vetting process to make sure that it's protected in there. And they use it for counts on rough sleeping, and they have those and all that stuff. And it's amazing because I can't think of another jurisdiction where they do that. They can have regular accounts on changes in rough sleeping over time. But a funny thing, and you were talking about this about the example of youth and not having the data. One thing they found is whenever they had a service push, they're like, we're going to end homelessness and put more services out there. They found that it increased every time. And it was funny, I was talking to them, they're like, oh, it didn't increase. We had more services, so we actually connected with more people. And you'll find this with data, and that's an important thing to think about. If you're supporting well and you're trying to end homelessness, you would expect if you were actually covering all the people, the first thing you would notice is it would go up a lot. And it's because you're actually serving those people and you're actually identifying and you're going there. And then it can go down as policy and all of these things affect. But we're not at that point. We don't have that. We don't have that complete data. So it's really hard to get to that point here in Canada because there's no one I think that would say that we're accessing, we're serving everyone that is homeless because we know we have estimates and we have other surveys. So we have to think about that if we're trying to prevent it. Community information exchanges, I'm not going to go into as much, but basically they're just sharing. They look different ways, but often they're trying to share their data across communities and organizations in a city to serve different populations. And actually, San Diego, one of their use cases was around homelessness originally. So I really think it's a great system, and a lot of groups are trying to adapt that approach. And it allows different data systems to talk together to serve basically the needs of those individuals. Youth is not being served often with the models at the beginning for other reasons, but once again, it's a great model.
So could you explain to everyone what linking administrative data can do, right? Like you have, you know, administrative data from different organizations or different public systems or, you know, government, and you're able to link those data sets. Why should people be interested in the possibilities around homelessness? Or just talk about, you don't yet even yet have to talk about it in terms of homelessness, but what kind of things can be done with linked data?
Well, I think it's a tricky question because when I think about linked data and the strict academic definitions often is like this is administrative data. It's not operational data. It's data that doesn't it has different things in terms of this. But the examples we gave with chain and CIE is more, I think, how we like to think about it. Is you have a person who comes into service, they come to another organization, and you know they're the same person. You have their name, you have their date of birth, you have some information. You link them together, and you can say they're the same person. They have these needs. We need to serve these other needs. So we learn more about those holistic needs of those individuals to serve them. And that's one example. But in most cases in Canada, that sort of use is very rare and it's very hard to happen because there's so many things that have to build up for it. We see it with the CIEs, the community information exchanges. They've been working on it for a long time, and what they've had so far is quite simple. But the other way we can talk about this is we have these huge data sets in the government where they collect all this data on all these individuals. You can link that data together, anonymize it, because, like I said, there's a lot of those privacy concerns. And then you can see this person had all this system impact. How did this relate to their homelessness? And that's actually the example I'll be presenting and talking about today. But maybe Keely and Kieran have other comments on that because definitely my viewpoint is.
Yeah, I don't know if Kieran, you want to go or if you'd like me to. Okay. Yeah, I think with as Matt said, sometimes with the work we were on, it was a bit of a different rather than administrative data. It was really focused on at the service provision level, what data needed to be shared to help youth access the services they need. And so something that I learned from the CIE team and also heard from our community partners is you also have to think about what happens if we don't share this information, and the consequences for that can sometimes mean direct serious harm to youth or even death, because if the difference between getting them access to housing is, let's say it's time limited, they're about to age out of services, And it turns out that this organization they haven't been connected to yet has this program that can help them get 3 months safety deposit to get rent. If that information that youth is in crisis doesn't get shared between these organizations, and that youth ends up in shelter or on the street in the winter, for example, or just thinking about the outcomes for them for being in the system longer, that can make a really big difference for an individual. So thinking about what that data sharing can do is it can save lives, honestly.
Kieran.
Yeah, I think the other thing that we've been thinking about is how it supports that coordinated services. There's obviously this, we all know what it's like in the day-to-day of social serving organizations. It's often go, 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 crisis response. There's not often a lot of time to kind of really sit down and map out all of these journeys and routes for a youth, for example. And so anywhere where there's this added potential gap or kind of, lapse in information kind of just adds more to the workload and the burden of now we've got to go find out this information to be able to make this happen. And so also thinking about the way in which it can support a service provider to be more kind of expedited in their work as well, and kind of remove some of their chasing around of folks and trying to get information and making sure that they really have all those pieces in place, but rather setting up a structure and a system. And one thing that we've really seen is that a lot of these things are happening. These wonderful moments of service coordination and integration are happening, but in a very unformalized kind of way. It's because this person has a really great knowledge of this person's program and they happen to be really coordinated and communicating. But a lot of these things are not necessarily formalized processes. And we all know that there's turnover and then someone leaves. And before you know it, that kind of system or structure breaks down. And all of a sudden, the trickle down effect is for that youth. They're no longer, coming into that service and then being connected to something else that is supportive in their kind of whole holistic support system. And so kind of really trying to create these clear structures and pathways and movements of data, I think can really we've also really seen how that's so important to formalize some of the wonderful things that are happening too, so that they do continue to happen and that there is that level of consistency in services for those youth.
Great.
Can I just
I want to
add,
ask, pardon?
sorry, Stephen, I just had one additional thought there that I don't think we touch on often, which is that when it comes to data being shared around youth, that can also have impacts for siblings or parents of that youth. So, for example, if an adult is accessing services and then that information gets linked and their child's name is also put in, then that can again be information that's really helpful. And for example, then two different caseworkers, let's say the adult has one and the youth also has one, can come together and say, okay, well, let's talk about housing this family together rather than viewing them as separate entities. So I think it just really helps to take that holistic view of the people close to youth as well.
Great. I'm going to ask a question about research and data sharing. So in terms of research that can be helpful to those who are delivering services or planning response to homelessness. Because my understanding is this can open up a whole new world in terms of longitudinal research, where in the past you had to contact people for several years, and it's super expensive and there's high dropout rates. Where can research be used in this way, and on what kind of things do you think it would be helpful for? So if you're thinking of longitudinal data, like why would that be helpful if you're trying to address homelessness?
Um, I was just thinking, I mean, of course, with the like administrative data, that's basically data from the organizations that's been shared with the government. Then you can see their bigger service use patterns, and when you
Right,
have enough data, you can actually say this is how all youth are doing in a province, and really strong conclusions and really strong policy changes can happen because you see those percentages. Um,
right.
but there's always a caution in terms of like I think the other implication in terms of research is sometimes as academics, and I am an academic by training, so I'm also poking at myself in this, is we do our research and we forget about those people. And that's what I'm saying. Once again, going back to the people, we forget about those communities and making sure it's useful to them in the process. So if we're doing this, it's extremely important that we make sure we have that collaborative approach and we're supporting the community there. And the funny thing is, I think most academics want to do that, but there's often not that incentive through the system or academia to do that. I know it's there and it's implicitly mentioned and all that stuff for grants and everything, but the extent to really do it is often not an evaluation to as much as it should be. But if we
Right.
really want to make change, that should happen to make sure that's happening. And it's not hard because often what they want is not something very complicated. They just want something a little bit earlier to help out them think about things, and they don't want an academic paper.
Kieran, do you have anything you want to say about that?
Yeah, I think in thinking about some of those kind of long-term, opportunities for research, um, I think there's an opportunity to see some patterns, right? And see, where maybe the breakdown of services is, or where maybe some of those, we talk a lot about the gaps and kind of, falling through the cracks, and where there are opportunities for data to bridge that, right? And I think, with some of this more kind of long term, or looking at for across youth, what are some of their shared or similar experiences where maybe they are hitting a point where they kind of fall out of a program or fall out of a service or miss an opportunity to be connected into a service. There is this wonderful opportunity to see some of those patterns and really turn that back into, okay, where can some of the energy be concentrated? Because I think what we've seen, as we'll talk about as we get into like our pilot, is that our pilot was so exploratory and so open-ended. It was, what can we do? Where are these opportunities? And then you start mapping it out and you start to see, wow, okay, there are a lot of little gaps and little opportunities that can be explored. But then thinking about, where is it going to be most impactful? And we're talking about just looking at two organizations. Now imagine you're expanding that to a larger network within a community, and all of a sudden you're starting to see where that energy could be concentrated. And, again, thinking about the limited time and limited resources, always wanting to kind of concentrate that effort. So I think that would be a really neat opportunity.
Great, thanks. Callie,
Yeah, I think uh, definitely agree with everything Matt and Kieran said, and just maybe a more specific case with a gap that I've heard about lots through this work is youth who are aging out of care. So when they hit 18 or 22 and no longer qualify for the program that they were in, so having longitudinal data that, in the sense of their information from certain systems or with certain organizations that only serve below 18, if that information can continue with them and be used to inform the services they receive in the adult system, I think that's a big help as well, so that we don't have kids falling through the cracks simply because they turned 18 and there wasn't a bed open at that time.
yeah, I think there's all kinds of possibilities, including being able to do outcomes evaluations of different interventions, right? Because you can track people then, did they re-enter the system later or did they stay housed or that kind of thing? So yeah, there are other possibilities too, which we'll get to. I'm going to talk or ask later about using data to support prevention by helping us perhaps predict outcomes more effectively. But I think it's a good time to move to talking about the two projects, right? So I'm going to hand it over for you to, you know, tell us about the project and what you've been learning. Which one would you like to do first?
Let's go Matt first. His kind of sets ours up.
Okay.
Yeah, sorry if I'm going first because the order, just because I think when we think about these two projects, so if we're talking about them and introducing them, I would always say that the start of the projects that we're really focusing on today is the roadmap for data to support the prevention of youth homelessness. So I did talk about that a little bit earlier. So in that, we engage with stakeholders across Canada. So hundreds of people, many sessions, many learning, engagement design sessions, many different things we did. And we engage with youth with lived experience, community service providers, government people from different levels, provincial, federal, funders, Indigenous communities, and researchers. So many different people to get that input. As we did that, we had many different learnings that I talked about a little bit briefly before, and also you can see more on the roadmap. But one priority topic was using administrative data to prevent youth, to inform systems change to improve the prevention of youth homelessness. So what is administrative data? That's data that's collected by many different groups. So homeless shelters, schools, all those things. So a school may collect your grades. They may collect, were you involved with inclusive education program? So sometimes we call that special education. In other groups, inclusive education is often the framing now. And you have a designation that was given for supports. You have those in your records, and they're just given back as things that have happened in your life. And they're all sent to the government for the reporting and all that stuff, and it's sitting there. What we found actually was that BC has a really great program called the Data Interpretive Program that has all that data there, and they put it together in a really safe space, and they've linked individuals while making sure there's no identities, there's nothing to identify those individuals, so they could look at the system use patterns for one person. So were they involved in homeless shelters? Did they need income supports? Did they need education supports? All those things. They have that there, and they have it for a really, really long period of time. So we saw this as an opportunity because I've worked with this data a lot, and working with it is hard, to just show this is a demonstration of what you can do with this data. And I'll present after these questions a little bit about some of those findings, but I just want to show that it is a useful thing, and it does have
Right.
those wonderful things. And often we say that's the pattern in BC. We can't listen to it to other jurisdictions. I've done that. I've done it in BC. I've done it in Alberta. They were very similar patterns. So we can learn from each other, and hopefully we can do more of that stuff. And as well, I was going to say, Kaylee and Kieran's work was also some of those priority topics from the roadmap, but they have more on that.
Great. Kaylee, over to you.
Yeah, thanks, Matt, for that setup. Because, yeah, as Matt said, the need to pilot a data collaboration between youth homeless serving agencies was identified through that Making the Shift work. As Kieran touched on, we approached it from a very exploratory lens to kind of work with partners. We identified two organizations in Calgary, Trellis and the Alex, and talk about how they could share data between them in a way that benefits their clients. So we did some initial conversations about the gaps and barriers that clients and staff currently face, and then moved into looking at, okay, what information could be shared to help bridge those gaps. Kieran, go ahead if you want to add anything else.
Yeah, we really kind of started off with this very overarching, big goal of increasing service coordination to support youth that are at risk of experiencing homelessness or are experiencing homelessness. And it, started off with two organizations that provide such a wide range of programs and
Mhm.
services, and there are so many opportunities. So it really was this kind of ongoing build of learning about each other's organizations and each other's services and programs to figure out like where is the best opportunity. And I think we'll talk about this a little bit later, but in our heads, and this is very naive of us, but when we started off, we thought the pilot will be this thing, like this one clear, here's the pilot, here's this innovative, cool solution. And as this project evolved, we started to see that the pilot isn't one thing. The pilot is really just this whole process. It's the whole
Yep.
process of relationship building, getting the right people in the room, learning about each other, and then really discovering where that opportunity is to actually share data intentionally with a clear outcome and purpose, not just, well, yeah, it's great to share data and we'll learn, but what's that really dialed in purpose for sharing this data? And then what's that specific data? And what's that mechanism going to be? And so it's been an interesting experience for us going through this, but we really started off with this kind of, initial development phase. And that really is getting the right people in the room and building that trust, building that knowledge, laying those really solid, almost like if you think like an analogy, like these solid bricks, this solid foundation for data collaboration. And it's so funny because I think we've mentioned this before, but we really weren't even talking about data at that point. There was just so many conversations about how and where there are opportunities to support youth. And so that's really kind of where that work started and where we started to identify what a meaningful partnership could look like and what's needed to facilitate that meaningful partnership that then ultimately leads to, okay, now there's actually some exchange of data, but along the way, there was constant data being shared. It was just at these different levels, right? Oh, you're so and so, you work at this program. I have lots of questions for you. And the way in which this pilot evolves, like I said, it's now a series of activities as opposed to this one ta-da kind of pilot thing.
Well, that's very good. Interesting. Okay, can you talk about the other program?
Oh, that is kind of I think Matt spoke to his piece and maybe now, and then we kind of spoke to our pilot piece.
Oh, I see.
So,
Okay.
yes.
Okay. Let me look for, um, okay. Based on your work, where do you see the future use and development of data infrastructure in Canada, focusing specifically on youth homelessness prevention?
Matt, did you want to kind of jump in and follow up on your pieces?
Yeah, maybe could we present a little bit about the finding just as that teaser before we jump into the future work? Just because
Sure.
if I talk
That
about
sounds
it, I
great.
feel like it won't make any sense to anyone at that
Okay.
point. Yeah, yeah, thank you. And it's just a short thing, and I just wanted to say up front that this is really it's a long series of work over the last year or many years actually that led to this project. So I just wanted to share that with, and I wanted to say thank you for everyone that's been so supportive in the BC government with this. Um, so, so first of all, just wanted to acknowledge we are funded by the government of Canada in part, and also the government of BC. Um, and I know we've been talking about this for a while. You wanted to see some findings. This is a chance to see some of those hints. There'll be more that'll come out that will be shared on the webpage that we've shared with you. Just remember, this is our opinion. These are all those things, although this is just all important things. It's not the actual data providers there. So we have to say this in every presentation. There's a lot of rules with the data innovation program. So what was the project? In my project, we were looking to use that data innovation program, that administrative data, to better understand childhood predictors, so 13 to 18 years old, that predicted later youth homelessness. You might say, why don't you predict earlier homelessness? Because we want to get it as early as possible and really do that. That data doesn't exist. It's not shared. It's not in the programs. There may be something there, but it wasn't something that could be used. So we did the best we could. We used 19 to 27 because that's how systems and programs are set up in BC. Actually, that link I sent around SAGE, which is about child welfare transitions, is really around that age period, and we wanted to make sure it matched policy. Another goal was to make sure that we had those stakeholders tell us how this impacts policy. Our goal wasn't to say we're going to change all policies. We wanted to have that discussion and make sure that that was part of the process. So we engaged with the BC government throughout this project, and also we wanted to have youth and community engagement throughout, but if the data use didn't allow that, in terms of you can't share findings once you do that, you have to keep it only in your communities, and that's a really hard thing. So we are having more of that deep engagement later, and we made sure that all of the engagement we've done to date was part of our interpretations. And then we wanted to make sure we shared that for learnings across Canada. So just as an example, we're talking about linkage and the potential list data of like linked data. So just for example, say you have a child and we're looking for those predictors. So what are some of those patterns that we could look at? So we could look at were they involved in the child welfare system? How many years, different patterns there? Were they involved in child and youth specific mental health supports, which are actually a unique sort of system in BC? How did they require inclusive education support? So things that we focus on were they in mental health, behavioral designations that they were supported for, or did they not get a diploma? Did their parents, were they involved in the justice system? So you can actually see that because you can link people together through other linkage in the data. Did their families use income support use? Because that's a family unit type program. And then finally, were there other needs in terms of substance use, other mental health needs for the parents or their children? Once again, we can see that with the data. So the point with this slide is not to say everything about this, but it's really impactful. There's a lot of data there that's there that can be used, and we didn't use it all. There's no things like that, but we can look at these patterns and then say, what if you had these different systems involvements? Each of them is the system. What were your outcomes like? Did you end up as homeless? So what did we find? We found that about 1% of the youth were actually showed visible homelessness. So that meant that they were in the shelters or they were shown as not having housing to their income support use. And this is an undercount. We didn't have all the years of data. We have to work with what we got. So we expected it would be about 2%. And if we had rough sleeping, it would be higher. We can't say that number exactly. We're estimating this, so I'm not saying that's a true number or anything like that. We just want to do our best with data. And I always caution you with this data, if we had the perfect data, we're going to wait forever and it's going to change somewhere along the way. So we don't. We work with what we got and stop complaining about it. Sorry, a bit hard about this because we just work with what we get because there's a lot we can learn from it. Another thing we did was we did look at the Stats Canada data. We asked for a BC specific table, and we found that they estimated about 9% were hidden homeless in about 2015 to 2019. So we have an estimate there. So we have these numbers, and it's important to have those because that's a big percentage of youth that could be served. And when we talk about youth that are homeless, the other thing we looked at is said, everyone was like, well, it's the housing system. How much can we spend for funding and programs? And I'm like, well, when you're talking about a youth that is homeless, they're involved in other systems at the same time, and many actually. So if a youth was homeless, what we actually found was 95% were on income assistance at one point during that period in our data. 65% had not received a diploma by the age of 27, which is a very high number. And not having a diploma doesn't mean that's the reason. There's other things that are leading to not having a diploma. So when we say we need to get people graduating and all that stuff, no, it's more than that. In terms of other things, 64% also accessed the healthcare system for substance use. 16% ended up with a custodial sentence, so they were actually imprisoned, and the percentage for offenses and all that stuff was higher. and 4% died, which is much higher. All of these numbers are very, very much higher than we'd expect for youth that were not in the that did not end up as homeless. Furthermore, when you're looking at the impact in terms of those systems, they're not just involved with one other system at the same time. Often there's many things happening. So 88% had three or more of those concurrent outcomes that I showed you, and 61% had four or more. So when we're talking about homelessness and serving it, we're actually talking about serving many other things, and preventing it is an issue that we should be doing because it is costly. And you've seen those papers. I think you've been involved with some of those, and serving them it can prevent some of those other outcomes.
Right.
Finally, this is really a prediction project. So other things we did is the really most impactful finding for me is when we looked at those patterns, those childless patterns that I showed before. Really, when we're predicting homelessness, what it's about is when you're involved in more systems is much higher risk. So of course, there's
Interesting.
risks from all levels. So 2% of children ended up as homeless and if they had one system involvement versus 25% with six systems involvement. And this is understated because we didn't have all the data. It could be up to double that amount. Very, very high numbers. But once again, we don't have perfect data.
Can I interrupt you for
Go
a
ahead.
second?
Yeah.
This is very interesting data because um, you had the figure of 9% were hidden homeless. Like we've never before been able to really have any even like rough estimate of how many people are in that category. But you can now do it, and this here, what you're showing now is data that would be really hard to do 5 years ago, hard to
Oh,
collect. So there's a lot of we're learning the power of doing these kinds of things.
yeah, and I agree. I think I know I'm presenting findings, which isn't really the goal today, but really I wanted to show that there is really important findings and the data
Yeah,
has changed. That was definitely a learning that I would say in the roadmap project is data is much stronger now, and there's a lot more we can talk about now.
good.
The other thing we found was both child and parent family outcomes and system involvement were strongly related to homelessness. So it's not just about the child, it's also their family. We know that. And a lot of these patterns we know, but we can actually see it in the data and we have estimates based on the amount. And I think that is important, especially to say we have these theoretical things, we have these surveys, the numbers are there. In terms of the greatest risk for children for homelessness, child welfare involvement was the greatest. But one comment that I would say was only 37% of all the youth that became homeless were involved in that system. So when I say that, that means another 60 some percent wouldn't be found in that system. So it's important that we address other systems as well and other patterns if we're trying to serve homelessness. And that's very important because often we think about this system as a very important one, but it's not the only one. Family poverty was also very important. If you're on income assistance, much more likely as we would expect to become homeless. And mental health supports, especially around substance use and schizophrenia, and more years of those were related to more homeless. The last one I would add in is, of course, education, not getting a diploma is very much linked, but it's really connected with involvement with other systems too. So it's not just the not having a diploma, it's also other issues and other things that youth are trying to overcome that affect their resilience.
It's an intersectional kind of uh, situation. Interesting.
Yes, exactly.
Great. You mentioned SAGE in British Columbia. For those of you who don't know what that is, that's the name of a program that came from the BC government reforming child protection so that people who in the past would be discharged at a younger age, I think in BC it was maybe 21, now we're eligible for supports, including financial supports, potentially up to the age of 27. So that's a new program. What were you planning to do with data and SAGE? Or is that
So
confidential? I'm putting you on the spot there.
Well, so I'm not going to speak like once again the data provider said we're not speaking on behalf of them and all that stuff, and I'm not going to. But at the
Okay.
same time, I will say so we did have as part of our process we had government ministries involved in our planning and our feedback, and people from Ministry of Family and Child Development were part of our partners, and they did talk about it. I'm not committing them to let everything like for, well, it's going to go, but there are discussions about here's some possible policy things that we could do in terms of connections with the child welfare system. But they do have a really great system and a really great new approach that they're doing with the
Yeah.
transition to youth homelessness, which says we're just going to provide those supports and those transition supports, and it's very much easier to access them. And I
Yeah.
do think it's like sometimes and I've said this before because I've done this administrative data analysis before. Sometimes you show a number, policy has already happened, and you say, and I've talked to DMs, and I said that policy matches the data. And
Yeah.
and honestly, I'll say it. I had one of those conversations in the past before Sage was happening, and I said, "This is the policy. This is what's going on." And suddenly, it wasn't this; it was other people's work and all that stuff. But having that data does give you that confidence to move forward when you're talking with policy and making sure that that policy sticks. And I say the data is really good evidence when you're making those, even if it's an existing policy. We know it's an issue. Let's talk about it. And definitely, I would defend it with our data that that is a very important support.
Can I offer up an example that
Yeah.
doesn't exist really in practice now? So we know from research, starting from Dennis Culhane about 25 years ago, that if 100 people show up to an emergency shelter for the first time, between 75 and 85% will resolve their homelessness on their own within a month or two, usually without much supports at all.
Mm.
So that's really good news. But the bad news is, what do we do with the 15 to 25% who don't leave homelessness? How do we identify them and how do we figure out what they need? Do you see that something like this could be useful in helping with prediction, but also planning? Could it be helpful to service providers to, if they knew that 25% were going to have a tough time escaping homelessness, that they could put more resources into those people?
Yeah, I think so. I think so. Knowing that, and of course, one of the goals with analysis was to focus on chronic homelessness and people that have
Yeah,
been longer. Unfortunately, that 25% also involves other interactions that may not show up in the data, and we don't have as much. So I hate to say it, but sometimes our chronic homelessness definitions don't show that really impressive number that we're hoping we would find in the data.
yeah,
Um,
yeah,
and it's tough. Definitely, their outcomes are worse. We can see that, and I can't comment on numbers because they weren't vetted for this analysis, and there are permissions there. But I would say that it wasn't this eye-popping policy difference or something that I was expecting, and
okay.
I was hoping to do it. The general patterns, all that I talked about, exist across all types of homelessness.
Kaylee and Kieran, do you have any thoughts on how these things might be useful? And if you want, uh, speak to the situation I was describing.
Yeah, I think what we're learning, and I think maybe it's helpful. I left everyone hanging a little bit around like what came of our pilot. So maybe I'll just quickly
Oh, that's
jump in
great.
and mention that because, like I said, it wasn't this, one stop fix all solution. What we realized was that it's a series of activities. And so by getting the right folks in the room, having these right conversations, we actually kind of learned that we needed to take things in this phased approach. It wasn't jumping
Mhm.
straight into what data are we sharing and what's the agreement and, let's get the papers and start signing them. It was actually, funny enough, starting off with knowledge building and relationship building activities. And so those upfront pilot activities ended up being peer walkthroughs. So we had folks from one organization go visit the other organization, participate in a little presentation, walk around, meet folks. We actually had some really neat things come out of those sessions, like a youth actually getting housed as a result
Wow.
of just one of those peer walkthroughs, which was really neat to see. And then we also, there's kind of the building of doing lunch and learns, but doing them together. So as opposed to, each organization kind of learning about, let's say, data privacy separately, bringing them together and going through that together so that they're establishing themselves on a similar playing field as they start to build things like a memorandum of understanding or an information sharing agreement. Because, you're realizing that organizations are coming to a collaborative with different processes, different policies, and you can't just kind of force them together. And so these lunch and learns, these kind of activities where they're interacting with each other, you know, we would just see how these conversations would unravel into like, oh, and what about that? And tell me more about your consent forms, and tell me more about, this pathway for youth. And all of that was so vital to understanding where this pilot should go and what's needed to, like I said, formalize these processes between the two programs that ultimately ended up getting selected to be part of the pilot. And so that was such an interesting evolution that kind of happened in a really organic way. And so, peer walkthroughs, lunch and learns, these sessions, these just ongoing learning ultimately led to identifying, okay, we're going to partner this program. It's called the All In for Youth program, with a mobile health bus that the other organization has that's traveling to schools that the other that Trellis already has, a
Right.
program. And it's like, oh, you're already there. Why not? Coordinate on a more formalized level. But all of that came about because of those relationship building, knowledge building
Right.
activities that were foundational to the pilot. And so now we're at the stage where it's like, okay, we can move into developing an information sharing agreement and looking at what existing documents are in place for both organizations to identify what should be in an information sharing agreement to really formalize these processes. So that's kind of how the pilot has actually evolved into something that's relatively simple, dare I say. It didn't need to be this big new fancy thing, but it needed time, it needed readiness, it needed assessment of capacity, and it also needed that bringing both partners to the same level where they felt comfortable to commit to something and felt
Wow.
like they each had the right amount of information, as opposed to kind of, let's just pick something and try it. It was this really mindful, really thoughtful process. So that's kind of the long story short of the pilot. And maybe I'll just pass it to Kaylee and she can speak a bit more to kind of the developmental evaluation piece, because we've also been monitoring and learning throughout this process as well.
That's very helpful what you were talking about, by the way, building
Yeah.
on that, the importance of the relational. So Kaylee, over to you.
Yeah, thanks, Kieran, and Steve. As Kieran said, we did a developmental evaluation throughout the whole process of this work, and so that allowed us to be monitoring, having reflection interviews with folks from both organizations, and really be intentional about, okay, what's currently working, what can we shift, what can we adapt, and then capturing our learnings so that we can share with other organizations who are interested in doing data collaboration. So we'll touch on a few of those lessons learned as we go, and we've got that link with more information coming. And then I think to the question you'd asked before, Steve, about for providers, what difference it can make to have that information about kind of which folks might be more likely to stay in the cycle. Kind of tangentially to that, I think what was really interesting to providers that we talked with was, if they do a referral and it's saying, go to the Alex, here's the address, they have this program, talk to them about it. If you're giving that information to say, a 17-year-old who's sleeping rough, um, they may or may not go. Anyone may or may
Yeah.
not go. I know I don't always follow the referrals that I get from health providers. And then the person who made the referral doesn't get information about whether the youth went, whether that referral was helpful, unless that youth happens to come back, but maybe then they walk in and they get a different provider that day from the same organization. So I think a big piece with having that shared data is closing the loop.
Mhm.
It helps, I think it helps the morale of these providers who are working their best, often with day-to-day crises for their clients, to know when something helped. And it can also be used to note, like, hey, this youth really didn't have a good experience at,
Right.
with this specific program, or once they went to that program, they shared something else that let us know about their eligibility, and using that to find the best resources for that specific youth and tailor their experience in the services. So I think those both make big differences to have that data to inform those.
Great. Thank you. These learnings are amazing. I was going to ask one last question and then turn it over to the audience Steph, how many questions do you have there?
One so far that I see Matthew's maybe working on answering, but yeah, feel free to ask your questions in the Q&A and we'll get to them shortly.
Okay. Um, so this is, crystal ball time. Uh, do you have any things you think about that you think are likely to happen? Like, where is all of this going? What do you see in the future for doing this kind of work? And I'll preface it by saying a lot has changed in the last 10 years in terms of the ability to do this in Canada. And so change can happen. So anyway, uh, who would like to go first? Or I can, Kieran, do you want to?
Yeah, sure. Yeah, I think for in our end, what we've really seen is that things can be made a lot simpler and a lot less scary for folks.
Nice.
Um,
Okay.
I think there's a tendency, kind of circling back to where we started, around data is scary, and people have different definitions and ideas about what data is. But if we come back to this core idea that it's the intention. Data is a tool, data is a resource, data
Mm.
can be powerful. It doesn't need to be this kind of ominous thing. Like, I think that's what we've really learned from our pilot is, because we've approached it from the direction of, like, let's explore, see where there's opportunity, and then see how data can be used, as opposed to kind of this, oh, we forced to share data, let's say.
Oh yeah.
um
Okay.
I think we've really seen the potential that's there for simplifying data sharing, and thinking it might just be a name, it might just be something simple like that, not this complex data set. But really coming back to some of these core considerations that you need to have to start those conversations can really, streamline this process and maybe take away some of those fears and those um, hesitancies to wanting to share data, or feeling like, it's it's a cumbersome or difficult thing to do. And like I said, we've just seen that it for us is a lot of formalizing things and just understanding processes and having the right conversations and grounding them in that intention and purpose, and then also making sure that you're kind of being mindful of how to support staff who are maybe also kind of scared of data, and see it as this thing that is for funders or for evaluators, and less of a powerful tool for them as well. So I think, and this is maybe just getting a bit more kind of uh, like philosophical about it, but I think there's this real opportunity to change the narrative around data. And
Mm-hmm.
really use it like help people feel empowered to use it. And I think a lot of that comes from these conversations up front, getting people on the same page, building that trust, laying those solid foundations before jumping into data sharing, so that you're kind of coming into it with this shared shared understanding. I think, one of the things we've talked about a lot is if there isn't a shared understanding, there's not going to be shared data, because ultimately it's the people who are sharing the data.
Right. That makes sense. Okay. Who would like to go next?
I can go next.
Okay.
Yeah, I think in terms of, I feel like I have like a pessimistic view and a rosy crystal ball view. But I think one thing that one of our partners said to us recently is when you're talking about the service providers and the ask of them to put in these processes to share data, it's really important to remember that these are charities and nonprofits who year over year are often getting asked to serve more people or try
Hmm.
new
Hmm.
innovations with
Yeah.
the same or less funding. And so we do need to recognize that, like, if that funding doesn't increase, it's a big ask for them, and it's a lot on their plates. And so I think um, movement towards having dedicated funding for people who can be in these organizations and take a multi-program, whole organization kind of view, I think that makes a big impact for when you're setting up data collaboratives. So
Right.
even shorter term funding to have someone really take the lead within an organization to set up all these processes so that it can go smoother after. Because when their focus is day to day and they're serving these clients, it's hard to have time to put towards an initiative that they might not see the impacts of very quickly, right? So I
Yeah.
think that piece. And then I think it would also be great to see. Um, Funding shift to be more open to like multi-organization proposals or things like, hey, we're these three organizations, we've identified this need, that there's this gap or there's this information that if we shared it, it would be way more helpful to our clients, instead of one org having to take it on and apply, or instead of organizations feeling like they're competing for the same funding because they have some overlap in the services they provide. If funders can set things up that make it more accessible to have organizations apply together or like explicitly
That's
encourage
great.
that, I think that would be really cool. And then the other piece is one of our partners, Trellis, did an initiative called One Door, where they shifted their intake forms so that every client fills out the same intake form. They get asked for the same data, as little as needed to get kind of the core information. And then when they're referred internally, um, every program is starting out with the same information. So they're on the same page. If they need some additional, then they can fill it out once they've been referred to that program. But I think more organizations moving towards that, so that from the youth side, they're not filling out four different forms before they're actually like accessing the help they need, or having to retell their story and be re-traumatized. And it's
Hmm.
also
Hmm.
just cleaner for the other impacts you can do with the data, because you're getting the same inputs in the same format. And so you've got a stronger data set as well.
Yeah, those are really good points. I think, to get buy-in from people to do something new, if people don't see that it's going to be helpful, they're not going to, not everybody, but they won't do it. If they do, however, go, that could be really helpful for us. And if it's demonstrated for them, um, then the data collection will be better, right? Because they'll be invested in it. That's a helpful thing. Okay, Matthew, over to you.
Um, I'm an optimist, and I'll say like I know you're hard on the data and how it is in terms of Canada, but like honestly, it like I've worked with the data, and
Right.
I've heard the realities of the community and all that stuff. I expected it to be abysmal. That's what I expected, just because, and this is not hard on the communities. It's just because it's a hard situation, and
Yeah,
it's people
that's right.
where things are really hard. You expect people to answer things and to allow the things that are necessary to make administrative data and link it together with individuals. It's much better than I expected. That's
That's
what I
great.
say. Like that's what I've said, and I'm like, I think it's amazing. There's a lot of foundations, and I think in this next 10 years, it's going to move forward. And we're going to have way more linked administrative data. It's going to move forward. We're going to see that. But actually, I'm just referring to the question we had in the chat. One reality of administrative data is it's rough data. It's not going to tell you everything. It's
Yeah,
not
yeah,
all
there are
those
limits.
specific drivers
Right.
and everything. So it doesn't replace the other data. It doesn't replace research. So when we move forward, one thing's going to be important is we use that and we show that and we show that benefit. And if that happens, which I've seen it not happen as well, and I've seen it happen, if it happens, things will go forward and it'll continue to be used and it'll be a nice indicator.
Yeah.
But if it doesn't happen, we don't get that support, then there'll be a bit of a clawback in terms of that data in the future because it can't be used for everything. We still need
Yeah.
that research and we need those other things. And we want to know those drivers, but it's great to have the big system
Yeah.
picture. It's just probably not going to replace those other things.
Yeah, it's one more tool in the toolbox. It just
Yeah.
so happens to be a big tool.
And
So
expensive.
and
Very expensive.
expensive.
That's the problem. I mean, it gets more efficient, but it is very expensive. We know data centers and the cost for all those computers and all that stuff to work on it. It's a lot. It's a lot.
That's great. Okay. Um, so what we've just been talking about in a lot of ways is like guidance for communities who are, interested in thinking about the possibilities of using data around youth homelessness prevention. Do you have any guidance and any additional guidance for them? Because I think people, your answers have all been very good. Anyone want to add anything more?
I'll just reiterate the point they were saying there is like we can have these fancy solutions and all those things, but I think the starting point is something simple. Something efficient and something that works with what we have. And I know that may not be what you want to hear. We want to have a new system and there's more impact and all that stuff. But it was funny. Like I was doing the data infrastructure work on the roadmap and trying to figure out how to do this. And we got those comments. We're like, well, what about the sharing table where we share about names? And then suddenly there weren't these risks in these communities about having all the information together. And it's really about serving those youth in those specific situations. They're really impactful.
Right.
And those are places where people are doing it and they have that potential and everything right there. So really making those simple solutions is a really nice place. Administrative data, I'd say the opposite. It's sort of the opposite of simple. Really, really hard to work with. There's a lot of legislation, things that have to happen for that to
Right.
happen. But if we want to do more of that work, one thing we need to do is work with those people that know how to do it as a starting point and make sure we do it right. Because if we do that wrong and we lose trust in the process, that's going to have some issues. So like,
Oh,
don't
yeah.
don't just assume that like what you see in the data is true. And that's what I say is like I always like come in with a detective's eye. Do I see a difference over time? This is following Stats Canada's sort of rules on data quality. Do you see a sudden shift? Oh, it's probably a policy change or a data collection difference. First, rule out those things and make sure it's done right. Because if you don't do that, then it's going to make it really hard to move forward. So I would always say partner with someone who has worked with that data is one thing if you can't do it yourself, or make sure you have that good training. So.
There will be more and more people who have these skills over time as well, right? So that'll
Exactly.
that'll make it more accessible for people. Kaylee.
Um, oh,
Oh, Kieran.
I was just gonna jump in.
Yeah, please
Go ahead,
do.
Kieran.
Yeah, just one thing that we've also been thinking about, and maybe a piece of guidance, something to try and something to consider, is using your own organization internally as kind of a petri dish to try things. Because
Yeah.
through working with various organizations and learning from the environmental scan, speaking with other organizations, we discovered that there's a lot of challenges sharing data internally at organizations
Oh,
as
that's so true.
well, right? It's not going to be a surprise to anyone. And so there's this idea of, like, I hate to use this term, like get your house in order kind of before you start with some of that external sharing. But there's this opportunity to use that as a little safe, contained environment to start building some of these elements of a data sharing collaboration with an external partner. And so I'd say like that's a really neat way to kind of, in the same way we did this very exploratory pilot, build these foundations, we're able to move at the speed of trust and relationships. That is easier internally with with yourselves, with your and there's going to be benefits for that for your organization as well. And so I'd say that's something to consider too when thinking about data collaboration. It can also be an internal endeavor, and what you learn internally can then be helpful externally as well. So just something to add because that's been a frequent topic of conversation with our partners too.
Yeah, yeah. I used to work at a community health center, and that was a problem. The data was siloed by the different professions,
Yeah.
and
Mhm.
the different professions didn't really trust each other. So, Kaylee,
Yeah, I
over.
think one of the biggest lessons was we touched on it a bit, but be careful when you're starting out about how you're referring to data and really try to come at it from talking about sharing information and asking people kind of what information they're currently sharing. One of our findings was that a lot of this information sharing is happening informally. Let's say
Right,
someone worked at Trellis, they moved to the Alex to become a case manager. And so their old
they get on
colleagues
the
at
phone.
Trellis say, I
Yeah,
know this person, and now they're at this project that we talked about over a coffee chat. Let me refer you. But if the person who holds that knowledge also moves to a different job, then all of a sudden those organizations don't have that same connection. And so
yeah,
it's really about approaching it from that method of like, hey, like out of curiosity, like who do you currently talk to? Where do you send clients if they need this thing that we don't provide? And then following those pathways and then figuring out, okay, is there any legislation governing this that we need to talk about? Can we sign an agreement that can be fairly broad that just says, when it's in the best interests of the client, we will send them here and they will tell us this information and we'll get a message back to know kind of how it went. Um, I think that's something I've learned is really the essence of the legislation around a lot of data in Alberta. And there's this fear that comes of like, oh, with health information, we have to be really careful about how we're sharing it, especially if folks are underage. But when you look at the wording of it, if you're doing it in the best interest to get them an essential service like having a roof over their head, there actually is a lot of that's a permitted use as long as you're getting the
right.
youth's permission and getting informed consent. And so I think trying to really approach it as like, hey, what can we share when it's in the best interest? What kind of do we need to keep in mind rather than coming from, okay, there's data and there's this really specific information from this legislation and like finger pointing and red tape kind of piece, really coming at it from how can we remove barriers to serve those clients best.
That's great. Well, it's now 1:30, and I want to thank all of you for being part of this presentation. It was fantastic. I learned quite a bit. Steph, over to you.
Yes. Yeah, I was going to say the same. Thank you, Matthew, Callie, and Kieran, and Steve for leading this conversation. It's been very interesting. And thank you all for joining us too and staying engaged right until the end. Um, just some final words on my end. Just wanted to let you all know that we'll be announcing the topic of February's panel uh, soon, so stay tuned for that. And we'd also really appreciate your feedback, like I said earlier. So take a moment to fill out the form that Lindsay will drop into the chat. If you have any further questions for us or for the panelists, feel free to reach out. We'll also drop our email into the chat. And since the session will be recorded, we'll be in touch probably next week with a link if you wanted to rewatch it or share with your colleagues.
Great.
And with that, we'll close the session. Thank you again.
Thank you.
Thanks very much.
Thank you.